Kids with autism tend to have more feeding problems than typically developing kids, and some kids can have swallowing problems too. Welcome back to another video. I'm your host, Dr. Mary Barbera, autism mom, behavior analyst, and best-selling author. Each week, I provide you with some of my ideas about turning things around. So if you haven't subscribed to my YouTube channel, you can do that now. Today, I'm presenting a very small clip from Theresa Richard, who was just on podcast number 178. And we talk about in the podcast her journey with her son who has a rare genetic condition. And we also talk about her expertise in swallowing. She has great information for other SLPs and even for patients who are having swallowing problems. So here's a short clip about Theresa Richard and her professional certification about swallowing. Let's pivot a little bit. And SLP is a speech and language pathologist. I've probably done 5 or 10 interviews with other SLPs during the 3 years that the podcast has been on. Love SLPs, love a multidisciplinary approach, especially as a registered nurse. I worked in the neuro field and the rehab field. So it was always multidisciplinary teams, multidisciplinary goals, trying to get people to be more independent. And I think one unique thing that we haven't discussed on the show is there is a difference between a medical SLP and a educational SLP that you would find in the school. I mean, they both have an SLP credential, but can you just explain the differences? Because you're clearly in the medical SLP world.
Yeah. So I mean, you're a nurse, think about it, right? There's a bajillion different settings you can work in. And that's essentially what it is for us too. We all graduate school with the same, degree. We all graduate with a master's degree, but then it just depends what setting you want to work in. So if you want to work in the schools, you might, your focus is more on language, expressive language, receptive language, communication, might be AAC there. If you want to work more in the medical setting, you would be in a hospital or a skilled nursing facility or, working in an ICU. So helping some of these patients with trachs and vents learn to regain their speech after a stroke or a brain injury, helping them swallow if they have a feeding tube. So it sort of is like two different worlds, quote unquote. And yeah, it just really depends what setting you want to work in. There sort of is also, there's the pediatric medically complex population too. So there are, SLPs that do work with kids, but they work with the more medically complex kids. So that's always a really fascinating area to work in as well. So we all do have the same degree. It just depends which setting you want to work in. And then, just as any medical professional, you just have to go on and learn more, take certifications, take more courses, to really hone in on that specialty.
So your specialty is swallowing. And so why don't you tell our listeners just some of your accomplishments or what you're doing, your podcast, your books, what you focus on with swallowing, because we probably do. I mean, I know we have SLPs listening right now and they may not know of you. And so why don't you tell our listeners what you have for SLPs?
Yeah. So I'm a board certified specialist in swallowing and swallowing disorders, sort of something that I just fell into, to be honest. I thought I would work in the schools. I thought I would work with kids and I just didn't like it. I ended up working in the nursing homes and loved it. So never in my wildest dreams thought that, I would love working with old people, but I totally do. But I just really found this love and passion for swallowing. I think, there's such a quality of life component to it. There's how many times, at birthdays or celebrations or Thanksgiving or Christmas, it always revolves around food. And to be able to take that ability away from somebody is really detrimental to their quality of life. So I just found it to be really something I was truly passionate about. And I just found it really fulfilling to be able to help these patients get, back to eating or drinking, at their, family dinner or Thanksgiving dinner. So I started writing a blog about, maybe 7 or 8 years ago. I had started a mobile fees company at the time, which is a mobile swallow study company. So basically I would contract with the nursing homes and I would bring equipment into nursing homes and do these swallow studies there. Yeah.
Yeah. Because most of the time, if you're in a nursing home and you have swallowing problems, you have to get to the hospital with
Correct. Yep.
specialized equipment to get these testing done. Wow. So you,
Yep.
you,
So we had the equipment and brought it into the nursing homes. Yep.
wow.
Yeah. Yeah.
So is
So
that nationally now or just in a couple of areas?
So I actually sold that company last year, but yes, I did run it in a few different states. So, but there's companies all over the country now that do it. So,
And you were the first to develop that?
No, I was not the first by any means. No, but I definitely was the first in a few states. So
yeah, that's excellent.
Yeah.
That was a possibility.
Yeah. So, what I sort of realized with that was that there was a lot of nursing home like administrators, doctors, nurses that understood the importance of swallowing assessments, but our own field sort of didn't. Speech pathologists didn't recognize how important they were, why they needed them, why they needed the tools, the training to do these things. So I sort of embarked on this education, escapade. So I started blogging. The blog, was popular. It took off. I just didn't have the time to keep up with the blog. So I created a podcast. So I have the Swallow Your Pride podcast. It debuted at number 11 on the Science and Medicine chart, and it has over 3 million downloads. So
wow.
Talk about all things swallowing disorders, and, just kept discovering that so many people want to know more about it. So I started a online community, a membership site for medical speech pathologists. We have over 6,000 medical speech pathologists in that community, provide resources, webinars, things like that. I also own another company called Medical SLP Education. It's medslped.com. And that's more solid foundational 8 to 10 hour courses on different areas of medical SLP. And then just realizing that patients need more information about swallowing disorders too. So I released a book last year called So You're Having Trouble Swallowing, and that was an Amazon and Barnes & Noble bestseller. So that book is written for patients. So if you're experiencing swallowing troubles, or if you're a caregiver to someone that's having swallowing troubles, it just talks about what your options are, what tests are available, what treatments are available, what questions you should ask, what you should look for.
So. Okay. Wow. So Swallow Your Pride is the podcast.
Yep, correct.
And medslp.com is the website where you can learn about your courses and your membership.
So medslped.com.
Oh, medslped.com.
Yep.
Okay. Well, we can put those in the show notes if you're out listening and running or driving. We can have everything in the show notes. Okay. So, let's talk briefly about swallowing problems in kids with autism. I know when Lucas was like 1 or 2, we had a couple episodes where he would be eating bread and kind of not know when to stop and be choking a little bit. And it wasn't extensive swallowing problems, but, and I know I have a whole chapter in my book, Turn Autism Around, about eating. And I know kids who have feeding problems, if they also have other signs of autism, are more likely to have it. And we can link Dr. Keith Williams is a really great episode in the show notes. And he's an internationally known BCBA who specializes in feeding. And he also has done some publications on swallowing and those sorts of things. But so how common, if you know, is swallowing problems in autism?
Oh gosh, I don't know. I don't know exactly that. And I think the hard part is to separate swallowing and feeding,
yes,
because that's the big separation. And my son has feeding problems. I wouldn't say he has a swallowing disorder. I wouldn't go that far, but he definitely has feeding trouble. So I think that's the hard part, because there's a lot of overlap there.
Mm-hmm.
Yeah, there's a lot there, obviously.
What are his feeding problems, if you don't mind?
So his is really just a strength issue. It's a tone issue. So he's low tone everywhere. Like I said, he's non-ambulatory. So he just has a very, very weak chew. It's very difficult for him to, propel the food, back into his esophagus. So he's not on, he can have some softer foods, but he has trouble chewing. If something takes too long for him to chew, or it's too hard to chew, he'll just spit out. So we're working a lot on just really strength of his chew. So that's just something that we have to be cautious of. And I think what's so fascinating is, he knows what he can and cannot eat. And there's things that, some foods will put in front of him, and I think he'll be able to chew them, and he just won't put them in his mouth, or he'll try to chew them, but just know it's too hard and spit them right out. So, it's pretty amazing what these kids are aware of.
I hope you enjoyed that short clip from episode number 178. If you'd like to watch the whole thing, go to marybarbera.com/178. If you like this clip, please share it with somebody who might benefit, give a thumbs up. And if you'd like to learn more about how to help kids with autism or signs of autism, you can attend a free workshop at marybarbera.com/workshop. I'll see you right here next week.